कविं कवीनामुपमश्रवस्तमम् ज्येष्ठराजं ब्रह्मणां ब्रह्मणस्पत आनश्वन्वन्नोतिभिः सीदसादनम् प्रणो देवी सरस्वती वाजेभिर्वाजिनीवती धीनामभित्रयवतु गणेशाय नमः सरस्वत्यै नमः श्रीगुरुभ्यो नमः हरिः ओम् भद्रं कर्णेभिः शृणुयाम देवाः भद्रं पश्येमाक्षभिर्यजत्राः स्थिरैरङ्गैः सुष्ठुवागुंसस्तनूभिः व्यशेम देवहितं यदायुः स्वस्ति न इन्द्रो वृद्धश्रवाः स्वस्ति नः पूषा विश्ववेदाः स्वस्ति नस्ताक्षो अरिष्टनेमिः स्वस्ति नो बृहस्पतिर्दधातु ॐ शान्ति शान्ति शान्तिः।
Om Shri Sai Ram. I offer my most humble and prayerful salutations at the divine lotus feet of our beloved Master, Bhagawan Shri Sathya Sai Baba, Director Dr. Sundaresh, all the doctors, staff, and all other invitees who have gathered here. A very loving Sai Ram to each one of you. When this beautiful temple of healing, this hospital got inaugurated, I had the privilege to be physically present here on that particular day on January 19, 2001. It was a very beautiful occasion where Prime Minister of India was present and many governors, many chief ministers also were present here. And in our introductory talk, he reminded us about Prime Minister Vajpayee ji. In fact, this is a year where in his inaugural speech, Prime Minister said, here, this is a temple in which dua bhi hai, dawa bhi hai, which means here you have medicine and also blessings of God, where you get both of them together in these beautiful portals of healing. How much of effort Swami has put in to give health care to people is something which all of us should go back and think through. Then if you read through, you will know how much work Swami has done in the field of health care. Many of you may not know, or if some of you also may be aware and following, that the first hospital which Swami built already completed Sashtipurti 60 years in 2016. 66 years back that Swami started his first hospital, Sathya Sai General Hospital in Puttaparthi, Prasanthi, in 1956. 1954 he laid foundation stone, and 1956 he inaugurated hospital. Perhaps for last 66 years any hospital is doing free service in the world, that could be only Sri Sathya Sai in a very private field. When that wonderful function of 60 years got completed, we had All India Institute of Medical Sciences Director as a chief guest. I was with him in the car taking him into the function. So he casually was asking. I said, do you know, doctor, this is 60 years old and 1954 was foundation and 1956 is when Swami inaugurated. He said, is it really? Whoa, he was very excited to hear all this. I said, what is it like? Why you are so excited? He said, no, I don't want to tell. I will tell when I get a chance to speak in the function. Then when his turn came, I was eagerly waiting for him what he's going to reveal. He said, see, that is the year in which All India Institute of Medical Science also has got inaugurated in 1956 in capital city of India. Swami, in a rural place, he started a medical mission at the same year in this country. And Swami, on the same year, he has started his rural medical mission in Puttaparthi, where hardly you had a difficulty even to reach that place. So, one side, the medical mission of this country starts in the capital city, and he also started it same time in a rural setting, in a remote place like Puttaparthi in those days. Not only hospitals, if you see across the globe, the number of medical camps, the number of medical care activities that Swami's devotees who are doctors, who are having hospitals, they do extend, it is amazing. It's just can't imagine the number of people who gets benefited by Sai system, Sai mission. I remember once a young boy walked into my office, and as soon as he came, he was sort of tears. He said, sir, I am studying in maybe first year degree. He said, I am alive because of Swami. I said, what happened? He said, no, I was 8 or 9 years old and I had a hole in the heart. So we were from a very poor background, and he was so thin and sort of malnourished. He was hardly less than 20 kg weight, it seems. He was at 8 years. So the doctor said it can't be operated, and you need to have a little more weight and little more health. So what the beauty of it is that the hospital kept him for 4 months, gave him food, proper food. Only when he gained 8 to 9 kgs of weight and a little more healthy, then they operated him and sent him back, and that boy studying, and he was studying degree, and he came to see me. When you hear these things, when you hear something so touching, it gives us a sort of renewed energy to be more dedicated and work in this Sai mission. Where else you can even to come close to hear such things? Where somebody walks into a hospital and he needs to go through surgery, but his physical body doesn't support it, and they give 3-4 months of taking care of him, nourishing him, completely free. Where do you find other than Sri Sathya Sai hospitals on this planet Earth? It cannot happen. Because everything here is sanctified by the divine. I remember this beautiful Kalisham from where maybe most of you cannot see, but on the standing here I can see only the beautiful Kalisham on top of this. The Kalisham was ready and kept in Vrindavan. It's around 5-6 feet height. All of us felt it's too oversized one, and I think what Swami is going to say about this. As soon as he came, he saw this, he said, how inta chinnada, so small one you have made it. So everybody is perplexed. All of us are thinking it's oversized, and Swami is saying, he's so small. He said, no, he should be nearly 9-10 feet minimum. Then everybody is surprised, and then they said, Swami, we were all thinking it's too big, it's oversized. He said, no, make it bigger. Make it 1.5 times what it is there. Then they went and made it. Only he could see that height, you require something like that to have a proportion. Otherwise, it won't look good in such a gigantic structure. If you put a small, it looks very dwarfed and it looks very out of proportion. Today it looks so nice because he immediately said it is not 5-6 feet, it should be at least nearly 10 feet. So that's how this beautiful Kalisham, he knew it. The moment he saw, the architects did not notice it, nor anybody could even guess it, but at 150 feet height, you need something like this to see the proportion. So everything, he was a engineer, architect, is a creator by himself, so he knows every bit of it. So that much of detailing that Swami went into, every bit of it, every inch of it is being sanctified. Today, yes, no doubt the doctors are taking good care of it and all of you are here, so much dedication they do, but it is you treat and he heals. That was, we should always remember. Healing happens only because it's in his hand. We can treat. So many times you do everything, but it doesn't work because that's it. That is something higher power that works into our lives. But we are so glad that Sri Sathya Sai Central Trust is always eager to support any humanitarian projects and continue to do so in this service of humanity, because people who are really in need, when they walk into this place and find something, and again that boy who got nourished from this hospital and then had an operation and now he's having a normal life and going to hospital, like that hundreds and thousands of people. The 18,000 some odd surgeries which they talked about, it amounts to CGHS rates of something to 500 crores nearly. That much of every year, that much of service happens from these portals, and we feel blessed, and I again extend all the good wishes to all the doctors, HODs here and staff, and who are the managers who are supporting, and Sai students, brothers are here who are supporting, and they continuously working to provide a sort of, it is not just a treatment, it's sort of just more than that, where we feel like as if is our own family member. Many times we will be clinical if somebody else we have to handle, but if we want to handle our own family member, we are very extra careful. We will have some sort of feelings, we do it. That is what we are expected, and Swami taught us to do, and each one of us, I can tell you, each one working here will treat every patient as their own family member and treating that, and that is the beauty of this organization, beauty of this hospital. I am sure this saga of service will continue forever and ever, and we all feel blessed to keep working in this lovely temple of healing. Thank you, and may Swami bless each one of you and your families, and with a lot of love. Thank you. Jai Sai Ram.
Started as a super speciality hospital of cardiac sciences and neurosciences in 2001, has grown into other specialties as well and become a multi-speciality hospital. Now, all the specialties put together and the support departments in this hospital have come up in a phenomenal way to address the increased workload that happened post-pandemic. There are so many patients who were due to be treated and could not be treated for over 2 years. And those people who were waiting, and a new horde of patients who needed this treatment had to be accommodated at the same time, which is not a possibility. But we managed to do at least a large part of it. Brunt of this was seen by the cardiac surgery department, which currently has a full complement of cardiac surgeons, 7 in total, 3 of them specializing in pediatric cardiac surgery. And they do on an average of about 6 to 7 cardiac surgeries in a day, out of which at least 3 are for children. In the month of November, we had a very unique camp of people from all over the world, specialists, doctors who are trained and specialized in pediatric cardiac surgery, pediatric cardiology, and the whole team of people, including nurses, intensivists, anesthesiologists, who, who came in all on their own, volunteering their service for a period of 1 week, and they worked in this hospital. Cardiology department has got 2 cath labs which are state of the art, and they are extremely busy doing more than 10 to 12 interventions in a day. And to supplement their needs, we have a team of people coming at least twice a year from the United States who come and do things that are not done routinely, and they bring in their might not only of their own expertise but also of material, almost to the tune of 1 crore each time they come. The Department of Neurosurgery has a steady workflow, and they keep quietly doing their work, treating various kinds of problems within the skull, intracranial tumors, vascular problems, and other spinal problems. We don't get to hear or see much of them because they don't make much noise. Out of these, it's interesting to note that about 15%, 10 to 15% of these children with intracranial problems, maybe tumors or other things, or maybe even congenital deformities of the spine, are children who without these surgeries would not survive for long, are being treated here very effectively. The multi-speciality departments of all the general specialties was moved into this venue from its old venue at Whitefield in the year 2016. And among them the general medicine, general surgery, pediatrics, obstetrics, gynecology, ENT, orthopedics, ophthalmology, all of them have grown from what they were at the old location to now, and we've become a multi-speciality hospital, which has been a very effective way of serving the people here comprehensively. The managing trustee was talking about the director of AIMS making some observation. So it reminded me of something that one of the ex-cardiac surgeons of AIMS, with whom I had a brief interaction at a meeting online, was mentioning that the kind of data that we have, be it physical data of patients' case files or images, I don't think even AIMS can boast to have. Sir, I would like you to note this. We have the most advanced archival system for data here. There is no paper in the outpatient services. All the images are stored directly on a picture archival system. And the amount of data we have from the last 21 years here is amazing. Today, when anyone talks about research, the first thing that happens is you open Google Chrome and type on Google what you want to know. It's not that. That's not what we're looking at. Nor is it an expensive hobby or a compulsive habit. It is very purpose-driven towards improving patient care. And to achieve this, the buzzword is artificial intelligence and machine learning. We have proven this to be possible, and we have collaborated with GE Healthcare, who are our neighbors here, and done a lot of research using the data that we have, which of course is work in progress, is not come out with something useful, but eventually it is going to happen. These kind of research take time, and it's definitely going to happen in the near future. And in the true spirit of what Swami always said, We believe niceness is what we show others when we don't stand to lose anything in the process. While love, kindness, and compassion is what we show when we are ready to sacrifice something, time, energy, or other material things. Here we believe and follow healthcare delivery with selfless love and compassion. Jai Sai Ram.
Chief Commissioner BBMP Shri Tushar Giri Nath sir. Sir holds a BTech degree in engineering and MBA in human resource management. He belongs to the 1993 batch of IAS officers and hails from the state of Uttar Pradesh. He has been in Bangalore for over 25 years, holding several state government positions. He was the chairman of BWSSP for 4 years before taking over as Chief Commissioner of BBMP in the year 2022. We would like to put on record that during the pandemic, the BBMP was very supportive in providing us vaccination, coming to the hospital and giving the vaccination to all our staff. And also whenever we have any trouble regarding any issues, civic related issues, they are very forthcoming and they have helped us. We would like to thank you for that, sir. Now I request Honorable Chief Commissioner BBMP to address us.
Om Sai Ram. My salutations to the feet of His Holiness. It is in the nature of humanity that if we are giving, then only we can receive. You would hardly find a person who had been perpetually giving has run short of money or material or something which he is used to giving. It is only the person who holds on will not be in a position to keep on. No, sometimes in the moment of kindness or some compassion somebody gives, then he thinks, no, I don't have enough of money, I will not give. That type of person will not be having enough of resources to keep on giving. So, it is a tribute to the great institution which has been doing yeoman service. Besides giving the blessings and treating the persons on all their psychological disorders, how we interact with others, etc., it had also been doing great service to the mankind. The amount of work, I used to be the CEO of Tumkur, then Pavgala was always fluoride affected, and that time the great work of giving water from the river to the adjacent place in Andhra Pradesh was through the trust. So they used to say, why when they can do it, why government is not doing anything? We at ZP, no, I have this much budget, we can only drill the bore and do some work. So it is in the way of thinking. If we think that we have to serve the humanity, the resources would come. And that is how this great institution had been helping thousands and thousands of people. And today, the Dr. Sahab was giving the achievement list of achievements, and every day around 1,000 procedures are 1,000 diagnostic tests are happening. In each wing, wherever surgery is happening, in the day 5 minimum surgeries are happening. These are all numbers, but the amount of dedication and devotion which goes to bring these numbers is enormous. Only the persons who are dedicated to a cause can do this. So, all the persons are coming from various places in blue attire to work from the most, what we consider as meanest, but with the most critical of the jobs of cleanliness, talking, providing some sort of service which we think that it is very menial. They are doing the greatest service. The doctors are doing service. So everybody here is geared up to do service, and that is why whenever we come to this place, or such great institutions, we also get enthused. We also keep on thinking what we are doing. In the morning till night, we keep on running around here and there. At the end of the day, we do not know whether what we have done, and next day in the paper it is again written that BBMP has failed here or there, etc., etc. So, but it requires a great type of commitment inside. If we know what we are doing is correct, then only we will get that courage to keep on doing something. We get scared in BBMP because we may not be doing everything so correctly. So it is better for us also to keep on visiting and understanding as to how we can give our utmost to the society. We may be taking something, we are taking salary, we are doing something, our jobs are all secured, but we are supposed to serve the humanity in a bigger way. Think big, serve them big. You will get enough of all the civil society people will give us enough of blessings and goodwill and strength to carry on with that. We may face here and there some hiccups, but these are the places where we have to learn that if we keep on giving, we will keep on receiving. So with this, as our managing trustee has already wished you a very happy Makar Sankranti. So each day you receive the blessings of Baba, and each day we should think what we have done at the end of the day for humanity, and that will keep us in good stead. Thank you very much.
I'm down memory lane. I still remember the day that this hospital was inaugurated. The day of the inauguration, we came for Swami's darshan in the morning, and I was in my traditional white attire. And Swami, after giving darshan, he came out, he saw me standing in the white attire. He said, "Are you ready?" I said, "Yes, Swami, I'm ready." Then he looked me up and down. "Are you coming like this?" he said. Then I didn't understand what he meant, because I was wearing whites and I thought that was the formality. Then after some time, Mr. V. Srinivasan told me, "You see, that question of Swami meant that he expects you in a formal function to be attired in a formal suit and a tie." And I was not ready for that. And so the minute this happened and Srinivasan told me, I got into my car. Of course, those days we could drive to my house in about half an hour from here. I rushed home, got a suit and a coat, wore it and came back here. And by the time the function was at 10 o'clock, everybody was here by 9 o'clock. And other trustees were all, wondering where I am. I'm supposed to be, they had given me a small role in that function also. I was not to be seen anywhere, and I reached at about 9:45 or so. Everybody was in their, wits' ends to say, where is this guy? And he said, "What is this? Where did you go away?" I said, "No, sir, I had to go and get a new jacket for myself from home because this is what Swami expected." So I thought I should at least remember that and come dressed like this today, otherwise. I'm quite happy with being in white dress all the time. Thank you, Swami. Thank you for giving us so many things. If you go on making a list of all what Swami has given us, I think we'll all be here doing Shivratri Jagarane till tomorrow morning, which we don't want to do because there's no end to our thanking Swami for what he's given us. Thank you. Thank you very much. Sai Ram.
Narayana Narayana Om Satya Narayana.